What is vancomycin? Vancomycin, when taken by mouth, is used to treat diarrhea. Oral vancomycin is also used to treat enterocolitis caused by certain bacteria. Vancomycin belongs to the family of medicines called antibiotics. It works by killing bacteria or preventing their growth. It will not work for colds, flu, or other virus infections. This medicine is available only with your doctor's prescription. This product is available in the following dosage forms: powder for solution, capsule, powder for suspension. Oral vancomycin works only in the intestines and is not normally absorbed into the body. This medicine will not treat other types of infection. An injection form of vancomycin is available to treat serious infections in other parts of the body. Uses of vancomycin oral. Vancomycin, when taken by mouth, is used to treat diarrhea. Oral vancomycin is also used to treat enterocolitis caused by certain bacteria. Dosing. The dose of this medicine will be different for different patients. Follow your doctor's orders or the direction on the label. The following information includes only the average doses of this medicine. If your dose is different, do not change it unless your doctor tells you to do so. The amount of medicine that you take depends on the strength of the medicine. Also, the number of doses you take each day, the time allowed between doses, and the length of time you take the medicine depend on the medical problem for which you are using the medicine. For oral dosage forms, capsules or oral liquid. For treatment of diarrhea, adults 125 mg 4 times a day for 10 days. Children, doses based on body weight and must be determined by the doctor. The usual dose is 40 mg per kilogram of body weight, divided into 3 or 4 doses and taken for 7 to 10 days. However, doses usually not more than 2000 mg per day. For treatment of staphylococcal enterocolitis, adults 500 to 2000 mg divided into 3 or 4 doses for 7 to 10 days. Children, doses based on body weight and must be determined by the doctor. The usual dose is 40 mg per kilogram of body weight, divided into 3 or 4 doses and taken for 7 to 10 days. However, doses usually not more than 2000 mg per kilogram. Side effects. Along with its needed effects, a medicine may cause some unwanted effects. Although not all of these side effects may occur, if they do occur, they may need medical attention. Check with your doctor immediately if any of the following side effects occur. More common: bladder pain, bloating or swelling of the face, arms, hands, lower legs or feet, bloody or cloudy urine, decreased urine, difficult, burning or painful urination, dry mouth, fever, frequent urge to urinate, increased thirst, irregular heartbeat, loss of appetite, lower back or side pain, mood changes, muscle pain or cramps, nausea, numbness or tingling in the hands, feet or lips, seizures, unusual tiredness or weakness, unusual weight gain or loss, vomiting. Less common: change in the frequency of urination or amount of urine, drowsiness, trouble breathing, weakness. Rare: hives, skin rash, redness or other discoloration of the skin, scaling or welting of the skin. Storage. Keep out of the reach of children. Store the capsule at room temperature, away from heat, moisture, and direct light. Store the oral liquid in the refrigerator for up to 14 days. Do not freeze. Throw away any unused medicine after 14 days, or if the liquid becomes cloudy or has particles in it.